Hi, I'm Todd Joye of InterveneMD, and today I'd like to talk to you about peptides. Peptides are natural chains of amino acids that regulate how your cells function in your body. Everybody's heard of peptides, they may not realize it. Insulin for diabetes is a peptide, and probably the most important and well-known peptide out there are these weight loss drugs like semaglutide and tirzepatide. Those are peptides. They've been around for 25 years, and there are about 7,000 peptides in the body. We only know of about 80 of them at this point, but they control how your cells communicate and how your cells fix your body. And there are peptides being used all across medicine right now. We use them a lot here at InterveneMD for musculoskeletal healing and to prepare people for my regenerative procedures. But they're also being used for a host of other medical problems. They're being used in cancer treatment. They're used for sexual health and hair loss. They're used for anti-aging, of course for weight loss. They're being used for inflammation and for gut health and for healing of ligaments and muscles. Because of all the great things that peptides do and the umbrella of effects that they provide, we have to tailor that to the patient. And we do that by, first of all, listening to them about what their goals are and what their functional limitations are. That's number one. But then there's no set protocol for this because everybody has different problems and they have different things they want to address at a certain time in their life in a certain order. And so we really have to look at these from a perspective of which peptide will do the most good for them for the condition they came in with. If you'd like to learn more about peptides, call our office or visit our website to schedule your consultation today.